I'm here with Professor John Bolton. Thank you for being here with us today. I have some question for you about. Can you tell us a little bit about what local authorities are doing for improving outcome for older people?
For improving outcomes, well, obviously every council thinks that when it helps an elderly person, when it's intervening in their lives, it's trying to improve their outcomes. Whether we're clear what that means when councils help people, and in a way what I'm trying to suggest to people, that we need to focus more of our efforts on helping older people live more active lives, recover from the problems they face themselves, and give people opportunities anyway to support the opportunities of their recovery. That's kind of like only a growing change in social care from the more traditional model of get people some care, sort them out. As long as they're kind of happy with that care, everything's fine in the world. So I think there is a seed change of people focusing more on a different kind of outcome, an outcome that actually expresses is the way we help you really going to maximise your opportunities in life, rather than just you're cared for, you're done, that's great.
Can you give us an example of a local authority that is doing particularly well with that?
Well, I think, as I've written about, I think the model that was developed in Wiltshire was spot on. I think their aspiration was to achieve that very aim. They've had some challenges on the journey of doing that. They found it was quite a complex process to get everybody, to get their social workers, to get the care workers all tuned in. They brought new care providers into the market. That took a while to settle down. But the spirit of what they were trying to do, I think was very good. And they probably have been the main leaders in that. Others have done smaller scale outcomes. So in Nottinghamshire, they've done some work on outcomes from hospital. And what happens, so we don't just focus on the delayed discharge, but what actually happens at the process of discharge to people. Do we actually offer them the best set of help we can help them, or because we're so desperate to get their bed free, is there a risk we dump older people into places that are the wrong places for them? And they're beginning to kind of look at that, so that as a health and social care system, they measure that outcome. So there's a growing number of small examples of councils beginning to think more about actually the way we help somebody matters, and can that make a difference?
And are there interventions that are particularly suitable for an outcome-based commissioning framework?
Well, obviously, the short-term interventions that people offer that are trying to help people get back on their feet, you can quite easily measure have we helped a good proportion of people. I would argue that even people with long-term conditions, there's some evidence in Somerset that one of the care providers, in Wiltshire, that one of the care providers there has a specialist team that helps people live at home with dementia. And the simple measure they have is that people are staying at home and they're supporting them and their carers. Well, that's very successful, and that's as powerful a message that you can help people if you've trained staff, if you pay them, if you retain them, if you look after them, if you support them, if you give them the right equipment, they can deliver good outcomes for people. That's very good too. So I think there's going to be a number of ways, either helping people maintain and sustain their lives with long-term conditions, or helping people recover. Both could be measured and could move to a much more outcome focus.
And what do you think is the primary rationale for a commissioner to engage in outcome-based commissioning practices?
Well, I suppose it's almost, the first thing I'd say is the traditional way of caring for people, there's lots of critique of that it does tend to just kind of like only see a procured service as cheap as possible get to somebody. We don't think enough about what that does for people and how that helps. whether it really helps or not. So I suppose the first thing is to say, actually, if we focus more on the outcome, we ought to be much more confident that we're actually doing the right thing by the care we offer people. So I think that would be the main reason why you'd move to outcomes.
Do you see any major challenge?
Well, it's very countercultural. I think, particularly in austerity, people think that that what they have to do is just kind of like make the money stretch further and further, and give everybody a little bit of care that they can, or be very strict about who gets care. They have to meet all their eligibility criteria. So the kind of stresses that people are under has not encouraged them to think, actually, what matters most is how we help people and the longer term outcome. Because even though that longer term outcome actually might help them save money, it's not the way they tend to think. So I think it's countercultural. It's a real challenge. And it's part of the way people have been assessed. People are assessed very quickly, get the service to them, next customer. It's a difficult change. It takes more time. People have got to think about it. People have got to think really seriously about the outcome that they're trying to achieve for somebody. So and that's not what people do.
Any idea on how to tackle those challenges?
Oh well, yes. I think in the way I talked about earlier, I think it's really important that people understand that this actually is a much better way of helping people.